Welcome along again to this Nurse Recruitment Secrets webinar. If you're listening on the podcast, hello, thanks for listening in. Today we're talking about something of crucial importance to American healthcare and nurse recruitment in general. Mr. Trump's one big, beautiful bill, the greatest bill in history. Today, I'm going to be telling you how it might affect you as a nurse recruiting organization, how it will affect your talent acquisition, your retention, your funding, and all that fun stuff. Now, the important thing to remember is, firstly, you got to focus on things you can control. I always say that. And whilst it is important to be aware and on top of this and plan ahead, really what you're doing in your day-to-day can improve your efficiency and make your nurse recruitment better manyfold compared to worrying or trying to predict what's going to happen in the future. I'm going to be playing off a couple of reports I've read. So one from Becker's Hospital Review, great publication if you're trying to stay on top of what's happening in healthcare, and a little bit of my own research. So when healthcare funding changes, nurses often feel it first. If it's more burnout, if it's lower staffing levels, if it's more patients coming in the door or not coming in the door, nurses are really bearing the brunt of a lot of to and fro healthcare. If we think about what happened during the pandemic, it was the nurses who really carried the health system on their backs and looked after people who were coming in unprecedented numbers for medical help. So we have to bear that in mind, that this really could affect your nursing candidate market and your nursing employees. So I'm going to be going over a few key points to consider and what you can do about it. So first of all, how is this legislation going to affect funding? Well, according to Becker's, it's going to cause revenues of hospitals to decrease, across the system as a whole by 4.5 trillion and reduce $1.2 trillion in spending. And this is why you might have seen some quabbles and long votes into the night a couple of days ago, because the national debt is going to increase by 3.3 trillion. The long and short of it is that almost 12 million people are going to be uninsured from Medicaid because a lot of rollbacks which are happening to the Affordable Care Act, which President Obama brought in. So how is this going to affect nursing? Well, one potential outcome is that because less people are covered for their healthcare needs, there's going to be fewer patients taking on elective surgeries, which will decrease the revenues of hospitals further. Now, hospital profit margins have been hovering around on average 1% to 3% over the past few years, certainly since COVID. And we've seen a lot of backlash from organizations like the American Hospital Association, because this bill could decrease that funding even more, because there's going to be less people paying in money to access healthcare services and access surgeries. This could be quite impactful for nurse recruitment. It could lead to cuts in the workforce or stagnation in wage rates that are paid to nurses, simply because the demand, the money coming into hospital systems isn't as high as it would have been if these cuts hadn't occurred. That might be challenging for you, because you'll be trying to sell your positions and attract more nurses whilst there's less money being brought into the hospital system and less money into your recruiting and HR funding. So that's one challenge, really, the cuts to Medicaid and cuts to overall hospital funding. Now, one interesting side of this is what happens to rural hospitals. I said that with such force because people often don't know what I'm saying when I say that, rural hospitals. So the revised bill includes $50 billion over 5 years for what's called the Rural Health Transformation Program. This aims to support rural healthcare systems. These funds will be administered by CMS and allocate $10 billion annually for fiscal year 2026 to 2030. Now, I think there's two sides to the coin here for rural hospitals. On the one side, it looks like funding is going to be adjusted in a favorable way. And this will help those rural health systems because they're the ones I think that need the support most. They're the ones that struggle to recruit staff. There's less competition in terms of you've got a hospital up the road that you can poach a nurse from. And that means that it's hard to find candidates. There's less people to hire, and all in all, it's quite difficult. If funding for rural hospitals is increasing and coming to your hospital, there might be an opportunity there for you to increase your wages or your remuneration and be more attractive to nurse candidates that might be moving out of cities or to try and attract them into your rural area. On the other side of the coin, 50% of rural hospitals' funding comes from Medicaid. That compares to 26% of revenues nationwide. So if those Medicaid cuts do occur, which let's remember are almost $1 trillion worth, that 50 billion is only 5%, I think, of $1 trillion. And it might not be able to counteract any Medicaid cuts that occur. It might level things out and make them even, or it might not. So what can you do about that? Well, if you're a rural hospital, you really need to look at how you're attracting candidates to come from other areas into your rural community. So I know it's hard, it's tough, and there's no magic bullet. You can't really control the number of nurses that are being educated. And I saw last year about 80,000 nurses, or potential nurses, were turned away from nursing school because there wasn't enough resources or staff to educate them. That's a problem. You can do some things about that, but not a lot. If you're a rural hospital, you really need to be looking abroad to the nearest city or the nearest big town and thinking, what about our rural area sells us and is special compared to this town? Common things are lower property prices, unless you live in a ski resort, more access to nature, and more safety. And we've seen this work. We worked with a client in Colorado, John Day, Oregon. And they had mountains, they had, that small community vibe. And we're able to put that out on social media and really say to nurses who are sick and tired of big cities, come enjoy a bit of the good life in our rural area. So if these funding cuts do occur and you're struggling, or if the funding uplift from that 50 billion does improve your position, I think the strategy needs to remain the same, that you're looking out to relocate people in from larger towns. I know you probably know that, but think really strategically about how you'll do that. So what is your core message going to be for the area? I think selling the area is a really strong point here, not so much the hospital. Talk about the lifestyle opportunity for a nurse to move and maybe play on some of the current kind of themes or existing pain points about people living in big cities in your state. So we're going to move on. Now, I've seen a lot of talk that this could dramatically affect the workforce in general in healthcare, that hundreds of thousands of job cuts might occur because of this decreased funding. Medicaid might be reformed under these proposals to what's called a block grant. So each state is going to receive defined limited set of cash as opposed to something a little bit more flexible, which is changeable. And block, this is your fund and you have to spend this. Since 2010, over 140 rural hospitals have closed. So that's why I kind of really played on the rural hospital theme for that. But also staff cuts might have to occur across the board because of that block funding. And if you're looking into staff cuts for nurses, I think you're in real trouble because there is a nursing shortage. And holding on to key staff experience is crucial. If you're able to do that in any way, think about if the funding position changes, how can you hold on to your staff? Be that more PRN opportunities, more part-time, more retention benefits. Really consider if funding does decrease, like this could all be overturned in 5 years if a new administration comes in. Picture can change very quickly. you don't want to damage relationship or brand reputation with nurses in this day and age. So be very careful about how you communicate any changes in funding, why it's happening, how it will affect your organization, who's to blame, and what your nurses can do to continue a relationship and work with you. And that extends to CNAs, extends to physicians and anyone else that might be affected by this. Really prioritize keeping a great reputation with your existing staff, and that will kind of blend out to the candidate market as well. So let's talk about immigration. I mentioned I am Irish, and 14 to 16% of registered nurses in the US are like me, not born in the US. So what could this mean for immigration? Well, we know that the current administration is trying to clamp down on illegal immigration, and they're also limiting legal immigration. So there is currently a large backlog of visa applications to become a nurse in the United States. If you think of some of the big feeder countries, you've got Philippines, you've got India, you've got parts of Europe, you've got Canada as well. Unfortunately, there is currently a kind of a blanket freeze on new visa applications being processed, and this is likely to continue if the bill is passed. If you think 14 to 16% of nurses are foreign born, if this continued indefinitely for generations, say, you're losing a sizable chunk of the workforce. And I think you need to really keep on top of this one, because if immigrant nurses can't be brought in and sent, particularly to those rural communities where a lot of them are going, that will exacerbate your nursing shortage. So keep in touch with whoever you're working with to get international nurses, understand how this picture is changing, and plan ahead to say, whenever the bill is passed, if it is indeed passed, how many months or years could this freeze continue? I've really kind of thought long about this, and the supply of nurses isn't going to meet the demand if these immigration rules continue. On the flip side, so to be fair, the GOP and President Trump would say that nurses need to be trained locally, and domestic supply needs to meet domestic demand. I'm not really seeing, unfortunately, a lot of additional funds or enough additional funds in what's coming out of this legislation to increase funding for nursing colleges and community colleges, other organizations training nurses and CNAs. I mentioned a few minutes ago that 80,000 qualified applications were turned away from nursing schools last year. And for domestic supply to meet domestic demand, there really would need to be a expansion of that. I'm talking about improved pay for nurse educators, more classroom resources, better scheduling, and just a broader general awareness campaign and improvement on what it means to be a nurse educator and why someone earning 120 grand as a year should get paid 100 grand as a year. Working in ICU, for example, for 120 grand should work as an educator for 100 grand. That blockage is really what's driving this nursing shortage, and a lot of the requirement to look abroad. And I would be very hopeful that if this bill or future legislation can look at that and solving that problem, something to unblock that bottleneck, that would be the answer. So In terms of what you can do as an individual organization, I would say engage with your local colleges and talk to them, give them information, tell them what your nurses think about becoming a nurse educator, and let them know how you can support them. One of the reasons for these applications being turned away is lack of placement opportunities, which seems a little bit crazy because there's hospitals out there that do need more support in nursing tasks, and there's these schools that need more placement opportunities. There needs to be something that brings them together. I know that maybe having what you would call an intern or a nurse placed student in there might take up some staff resources and sort of teaching them and showing them there must be a way that their work schedule can be organized, that they're doing something that is quote unquote productive for the facility. Reach out to community local nursing colleges and say that you're there to help. Ask them what you can do and work on engaging them to see how you can support local nurse recruiting pipelines, whilst at the same time staying on top of this immigration theme. So, covered a few things. This is an extensive list. It's just my brief analysis and recommendations. I do suggest that you go on Becker's Hospital Review. If you're in long-term care, go on mcknights.com to stay on top of this further. You can read the one big beautiful bill to say exactly what it says. And I think the American Hospital Association, some nursing unions are going to have it broken down in a more digestible way. That's all for me for now. I do wish you all the best, whether this passes or not. If you need help with your nurse recruitment or retention strategies, you can reach out to me on LinkedIn, Adam Chambers, or send me an email, adam@nurserecruitmentx.com. We've worked with 171 healthcare employers, helped source and hire over 15,000 nurses. So we know what we're doing and we know how to help you navigate these choppy waters. Thanks for watching, and I'll see you on the next one. I'm going to exit stage left. Goodbye.